If you're wondering if your newborn is getting enough milk, you're not alone. Feeding questions is one of the most common concerns that new parents have in the early days. Signs that your newborn is getting enough milk is if they're having at least 6 wet diapers in a 24-hour period, if they're steadily gaining weight, and your pediatric provider will monitor their weight. I would also like to mention that weight loss is normal in the first few days, but they should start gaining after that. And also, if after feeding your baby just seems more calm and satisfied, those are the signs that your newborn is getting enough milk. How often should your baby be eating? Most newborns eat every 2 to 3 hours, or they have 8 to 12 feedings in a 24-hour period. Formula fed babies might go a little bit longer between feeds, and some babies eat more frequently than every 2 to 3 hours. Frequent feeding is normal. Your baby might also cluster feed. This is a normal newborn behavior or feeding behavior in the beginning, which means that your baby is wanting to eat often in a short amount of time. So that usually helps to stimulate milk supply, and it also happens during growth spurts. Frequent feeding does not necessarily mean that you have a low milk supply. Your baby might just be going through a growth spurt or cluster feeding to stimulate your breast to produce more milk. So some common newborn challenges, let's talk about spit up versus reflux. So spit up in newborns can look very dramatic, but it's typically very normal. The muscle at the top of the stomach is still immature, so they might spit up frequently in the beginning. Reflux is when there's significant discomfort, and there's also can be poor feeding and poor weight gain. So if those things are a concern, then you might need to reach out to your pediatric provider for guidance. Most babies with spit up that happens occasionally are healthy and growing well. So it's considered a very common thing that you see with newborn feeding. Another thing that is very common in newborns is gas. Gas can be caused by your baby having an immature digestive system, and they also swallow air sometimes when they're feeding. This is why burping your baby after feeding is important, because it helps the baby to release the air that was swallowed during feedings. You might notice your baby being a little more squirmy after feedings. You might also notice them like bringing their legs up or drawing them up a little bit tighter, and they just might just be a little more fussy after feeding. The good news is that newborn gas usually gets better as your baby's digestive system matures. Cluster feeding is something that I've already talked about, but I want to touch on it again because it's a common newborn challenge. In the beginning, after baby is born, most newborns typically cluster feed, and this is just nature's way of saying baby's here, it's time to make the milk. I know that it can be very exhausting and you can feel like something is wrong, but it will get better as your milk supply increases. And a lot of times they'll feed very frequently over a short period of time. And then they'll tire themselves out, so they'll give you a break and sleep a little bit longer at some point. I'll say it again. I know it's exhausting, but I promise you it will get better. Sometimes feeding needs extra support. Signs that you might need to seek out help is if your baby is having a hard time feeding, like they're taking a long time to feed, or they're very frustrated with feedings, or they fall asleep relatively early in their feeding. If your baby has poor weight gain, and your pediatric provider will monitor this, you might need additional help. If your newborn is coughing or choking a lot during feedings, this is something to mention to your pediatric provider. I want to encourage and stress to moms to not push through a painful latch. it might be a sign that a lactation consult would be helpful. Next, I want to talk about a feeding strategy that you can use to help with feeding. So, most of the time, when I see parents feeding a baby in a room, they have the bottle in the baby's mouth, the baby is resting in the elbow, and they have the bottle elevated. So, what I recommend is called pace bottle feeding. So, pace bottle feeding is when you have and position the baby on their side. So, it mimics breastfeeding. And instead of holding the bottle elevated, you're going to hold the bottle more flat. So, the reasons that this position is helpful is that it helps the baby to coordinate their suck, swallow, breathe reflex. It's also a more natural rhythm for babies when they're feeding. And it also protects their airway. So when you're doing pace bottle feeding allows the milk to collect in the cheek and not the back of the throat, which can increase the risk of choking. So a lot of times you might hear pace bottle feeding when talking about premature babies, but I actually recommend pace bottle feeding for all babies. I also get the concern from a lot of breastfeeding moms about nipple confusion. Nipple confusion is not a texture, it's a flow problem. So it's a flow problem. So if you're breastfeeding and you need to supplement or give pumped breast milk, pace bottle feeding actually mimics breastfeeding because it has the baby control the flow of milk that they receive, just like when they're breastfeeding. And the position also mimics breastfeeding. So I actually recommend pace bottle feeding for newborns that need supplementation and they're breastfeeding over spoon feeding or giving drops or syringe feeding because those are actually faster flows than pace bottle feeding. So it actually minimizes nipple confusion because if you're spoon feeding a baby, you're just pouring it in their mouth and they have no control over how much milk they're receiving. And babies are very smart. So they'll start to prefer the easier thing and not work as hard at the breast. So using a slow flow nipple and pace bottle feeding actually has the baby work just like if they were nursing. Most feeding concerns improve with time and support. So if you have any type of concerns or feeding is just more stressful, I want to encourage you to reach out to your pediatric provider or your lactation specialist for support. Newborn care made simple.